Hello, my name is Dr. Cheryl Burdette, and I am the clinical director for Origins Incubator. And every week we meet and we have discussions about our cases. And this week we talked about osteoporosis and natural management of it. What do we do when we're approached with someone who's read about concerns about bisphosphonates? We are even concerned about them as well. We know there can be side effects in terms of increased necrosis of the jawbone and even increased femur breaks, which is the actual antithesis of what we want to do in terms of reducing osteoporosis. While there are lots of natural therapies that can be quite effective here, we still don't want to necessarily sit around and wait wondering what the outcome is going to be. And that's the problem with the DEXA, is that we're only going to be able to look at that once a year, sometimes only once every other year, depending on insurance and other constraints. So how do we know we're on the right path? Well, it turns out there's legitimate reasons to be concerned about bisphosphonates, because one of the issues is, first of all, they say don't even stay on it for forever. And second of all, so what do you do, after that if you can't be on it for forever? And second of all, even though it improves mineralization, it decreases interaction of osteoblasts and osteoclasts, so that remodeling slows down. Particularly, the cartilage within the bone becomes more compromised. And when that occurs, there aren't as many sites for the minerals to hold on to. So you end up with, yes, mineralization, but a more brittle bone because the cartilage is not there to keep it flexible. So in my experience, absolutely natural therapies can be quite useful in terms of shifting a DEXA, improving the score. But what do we do to make sure we're on the right track? So I particularly favor, for example, looking at an N-telepeptide. This is a marker that goes up in the serum or the urine as bone is being broken down. So we can get a baseline. We can begin our natural therapies or integrative therapies. Maybe our patient has a DEXA score that is so limited that we really need to make sure that we see some progress first, and then we can switch to natural therapies. And so we begin there. And we get that baseline first. And then every 3 months, we look at our therapy. And if the N-telepeptide is going down, we know that we're not losing as much bone matrix in the urine or in the blood. And so we know that our therapies are successful. So I have certainly seen DEXAs come up from, less than a 2.5, even to gain a whole point within a year using natural therapies. And when we use this N-telepeptide along the way, we know how aggressive we need to be. We know when to change therapy. We know if we're being responsible in terms of patient outcomes. And we're following that premise of first, do no harm. So just with a little couple tools like this, we can very effectively manage somebody naturally with osteoporosis and minimize side effects. So when we speak to the idea in terms of how evidence-based is the approach, this allows for the ultimate evidence-based individualization in terms of helping osteoporosis. And we know osteoporosis is not merely a deficiency of a particular medication. What we know is that it responds very well to a functional medicine approach. So as we talk to our patient about diet, exercise, getting adequate protein, all of these things become a big deal, making sure there's not excessive sodas, and then working on that nutritional part that's so important, we can really see these outcomes. In addition to that, we know that when there's more oxidative stress, this is something that causes an osteoblast, the one that builds more matrix, to peter out and become eventually just a fatty streak inside the bone. So really, a functional medicine approach, a whole person approach, is going to often give us the best outcomes. And now, by using something like an N-telepeptide, we can make sure we're not guessing about that patient's outcome.